A very warm welcome to all the delegates out there. I'm Dr. Namrita Sandhu, an obstetrician and gynecologist from India. And it gives me immense pleasure to be a part of this workshop and to talk about a subject that is very dear to me, role of artificial intelligence in healthcare, especially obstetrics and gynecology. Is it a boon or bane? I will also be talking about the opportunities and challenges of the technology, and most importantly, about the role of responsible use of AI in healthcare. Predicting the future isn't magic, it's artificial intelligence. Wise words there. Because predicting a future is not a dream anymore, because AI is there with us. Yes, without a doubt, we are in an era of possibility. And there is no denying that AI is going to be with us for the foreseeable future. We are now beginning to see the full potential of this technology in healthcare as a tool with the potential to transform patient outcomes. Now, have you ever wondered what is artificial intelligence? And how has AI achieved these learning capabilities? Artificial intelligence is a type of digital computer system that parallels the way the human brain processes information. AI is organized in a similar way that neurons in the brain are arranged, where there are multiple neural nodes and so are referred to as neural networks. The rise of AI has led to the subsequent development of artificial neural networks, which consist of a dependable mathematical system that can interpret multifactorial data. These neurons, connected via multiple synapses, enable computers to mimic cognitive functions, such as the reasoning process, to identify the most probable answer to a problem. This complex algorithm AI software is utilized in medicine to analyze large amounts of data, which can assist in disease prevention, diagnosis, and monitoring patients. Now, machine learning, deep learning, generative AI, I'm sure you've heard all these words. To simplify, all of it just means using some data, applying an algorithm on it in order to perform a task on behalf of or on assistance of a human being. The most significant advancement is a new technology called generative AI. It's the foundation of underlying tools like ChatGPT, and these models are actually producing human-like responses. Now, whether we like it or not, to be honest, AI is already ingrained in our society. From streaming service algorithm and facial recognition to voice assistants and navigation systems. Many smartphones, banking apps, social media apps use facial recognition in place of passwords. Streaming services like Netflix, HBO, all of them use AI to tailor personalized recommendations based on each user's watch history. Google Maps use artificial intelligence to determine traffic patterns and ETA, estimated time of arrival. Voice assistants are AI-powered digital assistants like Siri, Alexa, that can be used to complete tasks like making a grocery list, putting on music, reading news. So whether we like it or not, AI is already dominating a major part of our lives, from waking up with the alarm to going to bed at night with our favorite music, streaming service. AI is lurking from the background in every sector. AI seems to be a promising tool in healthcare, especially in the field of obstetrics and gynecology, for resolving several long-standing challenges. Now, one of the primary areas in which AI can assist clinicians in obs and gynae is in analysis of imaging data such as ultrasound and MRI. AI in obstetric ultrasound may be useful to predict adverse pregnancy outcomes, thus identifying patients requiring more intensive surveillance. AI holds the potential to improve the ultrasound efficiency, decrease inter-observer variability, improve detection of congenital malformations, and shorten the training duration to become proficient at obstetric ultrasound. Next area of application is CTG interpretation. A number of studies point to the use of artificial intelligence in CTG interpretation. AI can help give better quantitative and qualitative overview of fetal heart rate. It helps to decrease the discrepancies between different obstetricians interpreting intrapartum monitoring, and ultimately reduce the perinatal and maternal complications and morbidity. AI systems are available 24/7 and are not affected by human factors such as fatigue, distraction, bias, poor communication, cognitive overload, or fear of doing harm. Now, GDM, a major public health problem in India. AI can be used as a tool for initial GDM screening. Current screening for gestational diabetes is very costly and a burden for pregnant women. It would be worthwhile to evaluate the use of an AI calculator to screen for GDM patients, and that would be more cost effective. Artificial intelligence has also been used to predict the perinatal outcome in asymptomatic women with a short cervix. Now, we have used the artificial intelligence technology in combination with amniocentesis. Amniocentesis was done in some of these pregnant women to evaluate for additional factors that might put these women at risk, such as inflammation and infectious processes. This amniotic fluid was studied for omics such as metabolimics to shed light on potential new biomarkers that might be involved in preterm birth. The study concluded that using artificial intelligence in combination with amniotic fluid analysis was a superior tool when it came to the prediction of perinatal outcome in asymptomatic women with short cervical length. AI has also been used to detect preterm uterine activity, which helps in the accurate diagnosis of preterm labor, which at times is difficult to diagnose. Now comes the field of IVF. How can we forget the role AI has played in ART? AI has the potential to revolutionize the field of IVF by predicting the likelihood of success for a particular IVF cycle. AI-powered systems can analyze thousands of images of embryos and identify the one with the highest chance of successful implantation, improving embryo selection accuracy. AI-powered tools can monitor hormone fluctuations in real time, allowing doctors to adjust medication doses promptly. This control enhances the chance of successful egg retrieval and embryo development. AI can also give a correct and detailed report of semen without having any operator-dependent variations. All these great results help in enhanced success rate, personalized treatment plans, reduced costs, and time efficiency in the field of IVF. In addition, in IVF, AI can also help in single embryo transfer. AI's accuracy in selecting the best embryos leads to a shift towards single embryo transfers, reducing the risk associated with multiple pregnancies. AI may enable more comprehensive genetic screening of embryos, reducing the risk of genetic disorders. Telemedicine. Remote monitoring of IVF cycles using AI could make treatment more accessible to patients in remote areas. One cannot deny the benefits that AI could bring to the field of medicine. AI-powered tools are increasingly being used in early detection of gynae cancers. The AI systems use neural network models to deliver prognosis in patients with ovarian cancer. A study demonstrated that ANN was able to predict survival with a 97% accuracy. Another AI software was used that could predict prognosis in patients with ovarian cancer more precisely than current methods. And why is that important? Because currently, no screening for ovarian cancer exists, despite it being a common gynae cancer. The AI neural network uses complex interactions between microRNA and accurately identifies almost 100% of abnormalities that represent ovarian cancer, as opposed to ultrasound screening that can only barely identify abnormal results in less than 5% of the time. So you all can see the advantages AI has in cancer detection. AI has also appeared as an essential tool with urogynecology. So we cannot even ignore the field of urogynecology by assisting in diagnosis, treatment planning, surgical interventions, post-op care. AI algorithms enable urogynecologists to provide personalized and effective care. Last but not the least, AI-assisted gynae surgeries, one of the most impactful advancements in women's health care. AI can aid the surgeon by providing better imaging and spatial awareness. It allows surgeons to perform complex surgeries with incredible precision. Creation of 3D printing that replicates the surgical site is far superior to its 2D counterpart, as it represents a more precise version of the actual model, allowing a more accurate pre-op plan, hence diminishing errors in the OR. AI decreases operative time and accuracy, thus decreasing operative complications. AI aids in enhancing spatial awareness, cautioning surgeons about vessels or structures of importance, identifying them in a timely manner, and protecting vital structures. AI has so much to offer. As Jeff Bezos puts it, we are at the beginning of a golden age of AI. Recent advancements have already led to the invention that previously lived in the realm of science fiction, and we've only scratched the surface of what's possible. Now, all that glitters is not gold, and AI does come with its set of challenges. Number one being lack of data. AI models require large amounts of data to be effectively trained and tested. In some areas of medicine, such as gynecology, there may be limited data available, making it difficult to develop accurate models. Now, there is a problem of bias. AI algorithms can be biased, potentially affecting treatment recommendations and outcomes. There is a problem of limited interpretability, inability to handle uncertainty. Data privacy is another big one. Ethical dilemmas, another challenge. Use of AI in assisted reproduction also raises ethical questions, such as who should have access to this technology and the potential for designer babies. But there is a silver lining. As generative AI continues to evolve and become more sophisticated, it is poised to create a new wave of jobs that were previously unimaginable. From creative roles in the arts to scientific research positions, the possibilities are endless. So AI holds the power to revolutionize women's health. It can help in overcoming diagnostic challenges and improving treatment modalities and patient outcomes. We must embrace AI, yet be wary and, when necessary, recognize its advantages and drawbacks to continue providing the best patient care. Do not forget, AI is a tool. The choice is ours about how it's deployed. Now let's address the elephant in the room. Will AI completely replace humans, or can robots completely take over the OR? Absolutely not. At least not in the lifetime of everyone watching this video. The robots in the OR are going to be just tools to help doctors do their jobs a little better. AI will not replace medical professionals. However, those medical professionals that use AI will replace those that don't. To conclude, undoubtedly, artificial intelligence is the future, and the future is here. Thank you.